Dr. Sheila Ndyanabangi has been working in mental health for at least 30 years after graduating with a degree in medicine and surgery in 1981. Although she was responding to a calling, the start was not easy due to the negative perception people had of mental health.
It was the most gratifying experience I had ever had in my life as a doctor, because it was so dramatic that somebody who was very sick can get better and come back and is talking sense, and we could discuss and agree and plan for their treatment. My life changed forever.
Despite this negative attitude, she says the experience humbled and shaped our perception on mental health.
The patients taught me to be humble, because if you are talking to a mental patient and you are proud, you want to get any information, I had to come down to their level, listen to their stories, listen to whatever they are saying, even if it sounds like nonsense, because that's the only way I could get information to be able to treat them.
Dr. Ndyanabangi began her work at Mulago Hospital, then later moved to Butabika Mental Hospital before winding up at the Ministry of Health, where she heads the mental health unit. But over the years, she has concentrated on children's mental disorders. She says compared to adults, children's mental health is a complex issue.
If, let's say, a child is refusing to go to school, what is causing this child to refuse to go to school? A child is cruel to other children. Do they have a problem? A child is not growing at the rate of other children, not performing well according to how we expect them in class. All these, many people do not relate it to the mental status of the children.
It is here that care for such people becomes vital. There are many cases seen in children due to poor care, neglect, war, urbanization, drug abuse, and violence in the society. Other cases are due to epilepsy and nodding syndrome. But Dr. Ndyanabangi says parents should change their attitude on children with mental disorders.
So we need to treat not only the children, but we also need to look to treat the parents of these children. Because you cannot have a child who has a nodding syndrome and decide not to wash their face.
She says besides raising awareness on the plight of children with mental disorders, the ministry has also developed the Child and Adolescents Mental Health Policy. But she says the present laws on children don't incorporate aspects of mental health.
Because most of the patients we see in adulthood actually start early, when the people are still children. And by the time they come, when they already, you treat them, but they have missed opportunities. They have missed school, maybe they have been injured, maybe they have suffered. Others die along the way of other illnesses because they were neglected.
Dr. Ndyanabangi has received several accolades for her contribution to mental health. Some of the awards she displays at her home include the Life Service Recognition from Rotary Club of Ntinda and the Peter C. Alderman Foundation. Although she is yet to retire in a few years, Dr. Ndyanabangi, who is also a relationship counselor and a church leader, is not about to give up on her passion.
But I don't think that I will retire completely, because I have a lot of partnerships where we are doing work with the mental health, with substance abuse, with tobacco control. So I believe I'll continue doing some work, maybe with working with the other partners, NGOs, as we have been working.
UNICEF and the Uganda Child Rights NGO Network have partnered with NTV to highlight the plight of people like Dr. Ndyanabangi as they mark the 25th anniversary of the Convention on the Rights of the Child. Moses Akena, NTV.